Line up.
So today we're starting by getting our dogs in line, and today's puppy SNAFU video will be about how to give our dogs medication, because sadly all of them got Giardia. It started with Tug and then he spread it to the other two dogs. So what my dad found worked was, yes, he was the filmer last time, was that if you take peanut butter, and so it's a powdered medication, so he takes his peanut butter, he takes a spatula, puts the peanut butter on the spatula, and rubs the spatula in the dog bowl. And then what that's going to do is, once he puts the powdered medication on top of it, it's going to make it so the dogs will go through the medication to get to the peanut butter, eating it while they go, which is a very good idea. On a side note, today is Easter. We may love chocolate, but our dogs don't. Actually, our dogs do love chocolate, but chocolate does not love them. So don't let your dogs have chocolate or grapes or anything on the doggy poison list, which we'll get to later.
The doggy poison list is on the fridge.
And our doggy poison list, we're going to go take a look at it, and we'll be right back. So here are our dogs. Aren't they cute? And I'm just walking towards our fridge. And this is the doggy poison list. So they can't have alcohol, caffeine, chocolate, fatty foods, grapes and raisins, macadamia nuts, non-sugar sweetener, onions and garlic, salt and yeast dough, which is interesting. And we're back. So we've peanut buttered every bowl. Well, he has. I've just been narrating. And now we're ready to take our powders. And we made a little chart. Well, he did. He did all of this. So there's Rose. She needs 2 medications. Tug needs 1. And Moose needs 2. So Rose and Tug, it's their final day because they need 6 days of treatment, and they're at 5. And then Moose needs 4 more. So yeah.
And in addition to that, because Moose is the old man,
He also needs his medication for Cushing's disease.
he needs his Cushing's disease and also for his mast cell tumors. So I forget which of these is for which, but that's 3 Benadryl and 1 Pepcid AC. I don't remember why, but my vet told me to do that.
So there you have it.
And then
We have our powdered medication, and seriously, I don't know why somebody invented powdered medication. That's got to be messy, especially for dogs.
Yeah.
And so we're
Why
just
would you do this?
pouring it on top of the pills. There's my dad's arm. Opening another packet, and that one will also go into Moose's bowl. Moose is very sick. Poor guy, but he's happy. He's smiling.
Seems to be doing really well.
Yeah, no, he's
puppy
sick,
with
but
so
he's
many
smiling.
ailments.
See, that one's him. Here we are,
So
preparing the
the
bowl.
other thing I do,
I feel like I'm on Top Chef right now.
yeah, it really does kind of feel like a chef, because if you're used to like buttering pans or flouring pans, that's essentially what I was doing. But I used peanut butter instead of.
Okay, so that's what our finished product looks like. And here's what it's going to look like for the other ones. Theirs isn't going to have the pink pills because they don't need the pink pills, or that little white pill. I don't know if you can see it. And they don't, and the little boy, Tug, needs 1 packet. Is that Tug?
Nope.
So that one's Rose. So Rose is going to get another packet, but she's not going to get the pills because she doesn't need them.
1 orange and 1 green.
Mm-hmm. And Tug just needs 1 green, as you can see on this very handy little chart. And I would totally recommend making a chart if you have a giant whiteboard in your kitchen. Yeah,
we have a giant whiteboard.
I know, right?
It's awesome.
Yeah, it's really helpful too. You know.
Highly recommend the giant whiteboard.
Yeah, highly recommend it. It's great for doing things with dogs.
It's great for doing things for all kinds of stuff.
Mm-hmm. And
Alright, we have medicated that last one is Little Tug.
And Dad, would you
Yeah.
say, do you put the dog food on top of these, or do you feed
I
them
do.
separately?
No, I put
Okay.
the dog food right on top.
Which is great. So now we can also film how we feed them. So
Okay.
as you can see, there's 3 of them. We've got Tug, he's the little one, his mom, Rose, and big old Lucifer. Moose is the star of this video, clearly. So little Tug goes first for feeding.
No, he doesn't.
Oh, well, no he doesn't. Moose does. Never mind, I thought Tug did. I don't know, I always keep an eye on Tug while he
Here comes
eats.
the food.
Here comes the food, okay everyone. So Moose goes first.
Well,
So we poured
I
in
put food in. All 3.
Yeah, but we give him. And then we'd get the other 2.
And just to make it even more complicated, each dog gets a different food.
So we color-coded their bowls. Well, the food storage containers. They require a lot of food, so they each have 2 containers. And so does Moose. And try not to do what Dad just did, which was spin the lid. Just smack dab off. And now we're ready to start the process.
Line up.
So they line up, which is a really cool command. I totally recommend it. Sometimes they do it, sometimes they don't.
It's a relatively new command. We're still working.
Yeah, they're still learning. And of course, when one of
There
them
you
comes,
go. Good line.
good lineup. Dad,
Good
move,
lineup.
move, so I can get the actual lineup. Yay,
Good
that's the lineup. Aren't they adorable?
Stay.
Going young and old. Hey, Moose. All right, whatever. So now these 2 are gonna get their
Rose.
food in each hand, and they always know where their dog bowls are. So there's Rose, and Tug, and Moose. Anything you have to say?
No. I'm very happy that the dogs are doing much better at feeding. They each have their own separate corners, and they're very good about going to them.
Yeah. And also, we highly recommend a heavier dog bowl because for a while we used a tiny green dog bowl. Bad idea.
But even this little light plastic one,
Yeah, yeah.
Rose was pushing it all over the floor.
Yeah, so some of these wonderful bowls have experienced something called floor tours. Mainly sponsored by this one, Rose. Yes, floor tours. Stop laughing at me, will ya?
And if you see, Tug actually pushed all of his food. Well, now he's eating all the food too. But he pushed all the food out of the way and is going straight for the peanut butter. He's just licking that bowl clean. He's getting every last gram.
So that's how
That
our whole
medicine,
powder
which is
on the yeah. He's having all the medicine, and we totally recommend this for your dog. And yeah, so this is how we did it. And if there's anything you want to know, just put it in the comment section. Bye.